Hello and welcome to Medical Education Talks with William Beaumont Army Medical Center on Fort Bliss. This is a podcast for short. We'll be calling ourselves Med-Ed Talks Podcast. This is where TRICARE beneficiaries in the El Paso and Fort Bliss area can obtain medical information and everything that has to do with the El Paso market. I'm your host, Amby. I'm the Public Affairs Officer for William Beaumont. And with me is my co-host, Vince, also Public Affairs. Vince, go ahead and introduce yourself.
Hello, my name is Mr. Bird, or Vince. I'm a Public Affairs Specialist here at William Beaumont, and I will be the co-host for Med-Ed Talks.
That's right. So this is our first podcast, and as you can tell, both of us are suffering from allergies right now. So our voices are a little bit raspy, and we apologize for that. But the wind we had yesterday was unforgiving, really unforgiving, and not enough allergy medication out there. Right, Vince?
Yes.
Yeah, so this is our first podcast. We're going to be doing these once a month on certain health topics. For the month of February, we are focusing on heart health. Later on today, we're going to have Dr. Lynn, who's the Chief of Cardiology here at William Beaumont. And we'll be discussing a lot about your ticker there, your heart. What's the best methods to keep it going, what to do to keep it healthy, and anything else that Dr. Lynn wants to disclose with his expertise. So this podcast, we want to make sure that it is lighthearted and funny and easy listening to for our beneficiaries. So we are dependent a lot as well on your feedback, right, Vince?
Yes. So please subscribe, follow us on all our social media platforms, and we want to hear back from you. You can email us or call in if you have any questions or any comments or concerns. We'd love to hear back from you.
That's right. We're on YouTube, Facebook, Twitter, and the Gram, as my son calls it. And as we move along, everyone and their mother really has podcasts out there, medical podcasts, so to speak, as well. And we were Googling earlier, titles. So right now we're going to call ourselves Med-Ed Talks with William Beaumont. But we might change that. I don't know. What do you think, Vince?
Yeah, I think we need to change that as we continue and get our feet wet in the water. We might switch the names up, or we might ask the audience, what you think would be a good name for us. So yeah, we might switch our names up. So look for that coming soon. That's
right. We are welcome to your opinions and your thoughts about what our title should be as we learn and grow and take this audio journey with us on doing these podcasts. So in a little while, like I said earlier, we will have Dr. Lynn an interview on Heart Health Month. Join us soon after this PSA.
Hey, you. This is your heart. I know we've been through a lot, and I want to keep being there for you for the rest of our lives. I see every little thing you do for me and how hard you're trying. It's how you manage your stress. It's the way you exercise and the food you eat. I always appreciate the checkups and blood pressure tests. They're all great signs that you really do care about me as much as I care about you. As close as we are, make sure you're looking out for the red flags too, like the warning signs for a heart attack. No one's perfect. It's hard to create better habits like quitting smoking. This stuff takes work, but I'm so happy we're in this together. Love, your heart. Visit tricare.mil/healthy living to learn more ways to keep a healthy heart.
And we're back here today with the William Beaumont Med-Ed Talks, doing our first podcast. Here with us today is Dr. Lynn, the Chief of Cardiology Services here at William Beaumont. Sir, go ahead and let the listeners know about you.
Well, thank you, Ms. Pyan, for having me here. It's wonderful to be able to do this talk with you all today. As you said, I'm the Division Chief for Cardiology at William Beaumont. It's been a pleasure to be able to serve in that role here for the past 3 years. In addition, I serve as the Associate Program Director for our Transitional Year program. That's been wonderful. I'm an interventional cardiologist by background, and I also serve as an assistant professor for our Uniformed Services University.
Awesome. That sounds great. So we're here today to talk about heart health. Can you tell us why heart health awareness is so important?
Absolutely. It's a great question. Heart health is something that impacts basically the entire world. And it doesn't matter your race, your gender, your age. Heart disease is probably the biggest burden in terms of disease, death, and also healthcare costs, not only to the system, but also to patients and their families. So it's something that is a very, very big issue, no matter where you live, basically.
And with that in mind, how important is it to service members and their families, and why?
Service members are very important in terms of cardiovascular health because cardiovascular disease can really affect people of any age. You may be born with health conditions that may not be detected until you become a young adult. So we're basically our active duty population.
Right.
There's certain things we associate with older age, such as heart attacks, coronary artery disease, we call it, certain heart rhythm abnormalities, but those can actually impact patients of younger ages as well. We do see heart rhythm problems in some of our young active duty individuals. And heart attacks can actually occur even as young as the age of 35. So just because we take care of a younger population doesn't mean that it doesn't impact us as a military treatment facility.
That's true. So a lot of our soldiers take sometimes supplements or take a lot of drinks that may affect their heart. Do you agree or disagree?
No, that's absolutely a great point. You know, we have all these energy drinks on the market, and I'm sure if you polled a lot of young active duty service members, they'll tell you that, you know, they drink those on if not a regular basis, or at least intermittently. And we don't really know the true impact of some of those energy drinks.
Right.
We do know that some of those supplements, especially if they're stimulants, can trigger some of these abnormal heart rhythms.
Is it also something to consider when taking those supplements, even medications that you can take that can also affect your heart? Sometimes they don't mix well, right?
You're absolutely right. A lot of the supplements out there may not have FDA approval. So not going through that process, the person taking those supplements may not know what's actually in there. So like you said, that's a great point. It may interfere with medications that they are prescribed. Right. Affecting the effectiveness of that. But they also may not know what else is in there, ingredients which may have an adverse cardiovascular effect.
Wow. So what is the most important tip that you want to give our listeners when it comes to having a healthy heart?
I think the two things that we should all keep in mind, either as the individual, the patient, or the healthcare provider, is to focus on prevention of heart disease and also the early identification of heart disease. Right. Those are hard things to do. The primary prevention is something I think that we as a society need to do better at. And that really starts in the primary care clinics. Knowing what healthy exercise is, identifying patients who still smoke,
right.
Try to break them of that habit. But that requires a multidisciplinary approach to this, not just the primary care doctor, but maybe advanced practitioners, nutritionists.
Right.
Basically, it's a team effort to focus on healthy lifestyle as a whole. With the early identification, that's also very important.
Yeah.
Symptoms of heart disease can affect different people differently.
Right.
And so the common classic symptoms that we talk about with heart attacks, the elephant sitting on the chest pain radiating down the arms, those may be classic, but everyone's different. And so identification of symptoms that may be heart-related, talking with one's healthcare provider, asking for information. But I think having our patients and our beneficiaries know that, hey, these are some of the symptoms to watch out for, empowers them to seek help and seek advice when they're noticing something that's new.
What are some of those symptoms?
So like I said, the most common symptoms are kind of the chest discomfort, not so much a pain, but a discomfort in the chest that radiates down the arms. That's what we call typical chest pain or typical angina.
So it doesn't just, normally what I hear, it's that the right arm, but can it be both?
It could be both. It could be just the left arm. It could be just the right arm. I've certainly had patients where it's only the back, only the neck.
Wow.
And so it really does vary. Majority of the patients that we take care of, the classic symptom is a chest discomfort, someone sitting on their chest, a pressure-like sensation.
Having difficulty breathing, is that one too?
Yep. Difficulty breathing can come along with it. Some patients just present with that and no chest pain.
Oh.
Yeah, and so other patients may feel they just sweat without any of those shortness of breath symptoms or discomfort of the chest symptoms.
Right.
Feeling nauseated. A lot of things can make one feel nauseated, but certainly if there's any shortness of breath along with it or chest pain along with it, that does become somewhat concerning.
Yeah.
But a lot of these symptoms, again, it become difficult because they're not very specific for heart disease. But in the end, one may find that actually suffered from heart-related symptoms. So
does genetic have a lot to do with it too? Like if somebody in the family has a history of heart disease, is it something that they should consider too with their provider, talking to their provider about? Absolutely. And that's a great point. There's actually been studies that have suggested the most powerful indicator of heart disease risk is actually your family history. Wow. Because we can do a lot of things, right? We can do the right things to keep our blood pressure low, keep our cholesterol well controlled. But sometimes there are things that we can't escape, such as our genetics. Right. And so if one has a strong family history, that might mean they're more prone to develop things like heart disease, blockages in arteries. Yeah. Certain heart rhythm abnormalities certainly too. So while patients having a family history, not to say that they're going to develop something, they just may be at more risk of developing heart disease. So they may want to be more aware at a younger age to say, let me start doing the right things now. Focusing on healthy diet, exercise, doing the right things to ward off heart disease. And do you think that diet and exercise really does contribute greatly to a healthy heart? It does. And, that's something that's been studied too. There's a lot we know about nutrition. Right. But there's also at this point a lot we don't know. And there's a lot of personalities out there in the media who have, advocated for certain fad diets. Yes. And so what do we do with those? Yeah. And so, keto is one of the biggest ones, right? That's right.
Keto is real big.
That's right. So, and, putting ourselves in the patient's shoes, what do we do with information? Who do we believe? Who do we listen to? Right. And so it is very difficult for the patient. It is. We do know from, scientific studies that the Mediterranean diet is something that's commonly referred to, and that seems to help reduce the risk of stroke. Oh, and cool. That's important because it focuses more on, lean meats, lots of fresh vegetables and fruits. And so I think that's the important thing to take away from all the studies that are out there is that if we can try to minimize things that are heavy in the animal proteins, certainly fried foods that are processed, a lot of sugars, a lot of trans fats, those are some of the things that we know to be harmful. And if we try to minimize those, that might set us on the pathway to having a healthier diet. Right. So bottom line, no matter what diet you're taking, lots of fruits and veggies. Correct. Watching your calories, trying to avoid some of those fast foods, salty foods, processed foods. Yeah. Oh no, I have to say goodbye to my fries. I know. And that's actually a very difficult part going in the future is because, as we start to focus more on the social determinants of healthcare, it's easy for us to say, you have to eat right, eat more plant-based proteins. That's healthy. Oh, no. But when you say plant-based, people are like, like that plant burger or something. Yeah. All these, I applaud people coming up with all of these healthier options. I do, but I think it's going to take us a while to get really used to all the taste because we're so used to, the Whoppers and the burgers coming out. But according to what you're saying, it's important, right? Yeah. And for some people, they may not have the means or the time to make their own foods or find these more expensive, healthier, quote unquote, options. Yep. So I think us as healthcare providers is also to be cognizant of where the person is coming from in their life as well. Awesome. So what does William Beaumont do for patients that have heart issues? What services do we provide? We at William Beaumont are very fortunate to be able to provide anywhere from the gamut of primary prevention to the treatment of advanced cardiovascular disease. So referrals will come to us from the primary care clinics where they just want us to do a primary evaluation. Is this patient at increased cardiovascular risk, and what can we do about it? Cholesterol-lowering therapies, tobacco cessation, things of that nature. Yeah, we do have tobacco cessation classes, folks, so
to keep an eye out for that, or contact our Army Public Health Office to sign up for the tobacco cessation classes. Yeah. So what else does Beaumont provide for heart issues with patients?
We try to do our best for our active duty service members, especially ones who are mobilizing. We want to make sure that they're medically ready. And for folks over a certain age, that includes making sure that their cardiovascular risk is evaluated based on current Army policy. And we try to do that without delaying their mobilization, but also making sure the soldier is taken care of.
Awesome.
We also take care of, folks who come see us in the hospital, who come into the emergency room, or through some of our inpatient services with active cardiovascular disease. And we're able to take care of them through various either office-based or invasive procedures to identify and hopefully treat the underlying cardiovascular disease.
Right.
Over the past 3 years, we've been fortunate to increase how many office-based procedures almost by a third to try to increase the access to care.
Awesome.
Working with hospital leadership and our Army consultants, we hope to increase the number of cardiologists we have in the coming summer so that we can now expand these services not only to our active duty folks, but also maybe to beneficiaries and hopefully even to the VA population as well. So we can really take care of our beneficiaries and our veterans.
So you heard it here first, in the summer, we're going to look for cardiologists hiring.
That's our goal.
Right?
That's our hope. That's been our drive. We want to be able to take care of everyone, and that's certainly going to be our goal and our push to increase the amount of cardiovascular services we can offer through the hospital.
That sounds great. That's awesome. We'll look forward to it. So any last comment that you would like to share to our listeners, our TRICARE beneficiaries listening to our podcast?
I think the important things for everyone to understand is prevention goes a long way.
Yeah.
And the earlier it starts, the more benefit someone will see from that. So start early, eat right, put away the cigarettes, don't use tobacco, even all the vaping and the supplements, legalize marijuana, all those things. Whatever we put on our body can always have an effect.
That's right.
And also, don't put off or don't ignore some of those warning signs. Talk to your healthcare professional and get some more information.
Awesome. Thank you. So you heard it here at William Beaumont from Dr. Lynn. Thank you so much for joining us, sir. And we'll be back after this quick public service announcement.
Do you have a non-life-threatening, non-emergency illness or sickness? Do you need non-emergency treatment? Then urgent care is the right place for you. Urgent care is often the best option for treating colds, flus, sinus and ear infections, or minor cuts and burns. If you need help finding care, call TRICARE's Nurse Advice Line 24/7 at 1-800-TRICARE or 1-800-874-2273 and choose option 1 to talk to a registered nurse. To learn more, visit www.tricare.mil/urgent care.
Welcome back to the Med-Talks. We just finished our interview with Dr. Lynn, talking about heart health awareness. He gave some really good pointers, didn't he, Vince?
Yes, he did. He gave some really good tips and a lot of information I didn't know about.
Yeah, I'm going to have to give up my fries.
Yeah, no more keto diet for me.
Any diet that you have that you decide to go on, I think it's important, like you mentioned, having those fruits and veggies in there, and the keto does have that, but I think it was meant specifically for certain patients, and it doesn't work for everybody.
Yeah, I got to add more celery and green leaves to my diet. My wife's been telling me that for the longest, but I'm a good old hamburger and fries guy.
Steak and potatoes.
Yeah, steak and potatoes. But a lot of information he put out that I didn't know. I love energy drinks. I'm going to have to cut back on those and sugars.
Yeah.
So just a lot of things in moderation.
When I was in the service, I did drink a lot of Monster drinks. I had those energy drinks. It helped me get through a day.
Yes.
A hard day that I had very little sleep on. It really did. But then later on, I found out it has a lot of sugar content. So I had to cut back on those.
Yes, me too. A lot of the Red Bulls and the pre-workout supplements he talked about, a lot of that stuff, I was aware of, but I didn't know into deep.
Yeah.
So I'm glad it was very informational. I learned a lot, and you know what? I just got to critique my diet and just cut back stuff in moderation and do more working out. So
yeah, you and I in our age, we got to be more.
Yeah.
We got to be more cognizant of what we're taking. Any supplements can mix with our medications now that we're retired, broke veterans.
Yeah.
You got to make sure we know what we're doing. So take care of our heart.
Yeah, we got to get out. And like my wife was always telling me, just, get out and walk more, ride the bike more, and get out and do more daily exercise.
Yeah, definitely. Walk more.
Yeah, walk. We get caught up in the grind of working so much and the hustle and the bustle. I think we just need to add more exercise into our routine.
Definitely. Yeah. That is a definite that we need to start doing in my family for sure. I know my kids like to do a lot of sports, but I'm that mom that sits in the lawn chair on the sideline. Maybe just get up and the kids walk the dog, but maybe I could walk the dog around the block a few times. Granted that the weather gives, a little bit more of a enjoyable weather.
Yeah, the weather permits, yes.
Around El Paso right now. But yes, Dr. Lynn gave some amazing points for us to help keep our heart healthy for this month's Heart Health Awareness. But you, the listener who's the TRICARE beneficiary, we like to hear your feedback. So use our platforms to reach out to us on YouTube, whether it's also on Divots and on YouTube, Twitter, and the Gram.
Please like, subscribe, share, follow.
Yeah. The feedback that you provide to us really entails how we're doing, what's important to you, what do you want to hear about your healthcare here on Fort Bliss in El Paso for the military service member and the veteran. And with that, we close our Med-Talks here at William Beaumont Army Medical Center. The views, thoughts, and opinions expressed through this podcast are the speaker's own and do not represent the views, thoughts, and opinions of the Department of Defense, the Defense Health Agency, the El Paso Market, and William Beaumont Army Medical Center. The material and information presented here is for general information purposes only. William Beaumont Army Medical Center and all forms and abbreviations are the property of its owner, and its use does not imply endorsement of or opposition to any specific organization, product, or service.